All right. Hey there. I'm here to talk about polycystic ovarian syndrome. And I'll go over what it is, review some of the anatomy, the pathophysiology, and some of the risk factors. So, polycystic ovarian syndrome occurs in women who have abnormalities in the metabolism of androgens and estrogen and the control of androgen production. PCOS can result from abnormal function of the hypothalamic pituitary ovarian axis, or the HPO axis. A woman is diagnosed with polycystic ovaries if she has 12 or more follicles in at least one ovary. So to review the anatomy, the female reproductive system is composed of the vagina, cervix, uterus, fallopian tubes, and ovaries. The main purpose of this system is to transport mature eggs from the ovaries to the site of fertilization within the uterus through the fallopian tubes. If the matured egg is fertilized by a male's sperm, the egg is then transported to the uterus and implanted, and the female is considered pregnant. If the egg is not fertilized, the egg passes through the uterus and is shed along with the lining of the uterus, which is the beginning of the menstrual cycle. And when a woman has polycystic ovarian syndrome, the matured eggs have difficulty exiting the ovary each month because of all the cysts that are in there. Instead of being the egg is in the ovary, cyst fertility because the egg is not able to meet with the sperm in the fallopian tube and then get implanted onto the uterine wall. So this is usually caused by hormonal imbalances. So to review the pathophysiology, polycystic ovaries develop when the ovaries are stimulated to produce excessive amounts of male hormones or androgens, in particular testosterone. And this can occur through the excessive release of luteinizing hormone by the anterior pituitary gland or through high levels of insulin in the blood, which is also referred to as hyperinsulinemia, in women whose ovaries are sensitive to this stimulus. A majority of women with PCOS have insulin resistance and can be obese. Their elevated insulin levels contribute to or cause the abnormalities seen in the hypothalamic pituitary ovarian axis that lead to PCOS. Hyperinsulinemia increases the gonadotropin releasing hormone pulse frequency, luteinizing hormone, and over domination of follicle stimulating hormone. These increase the ovarian androgen production and decrease follicular maturation in the ovary, and then all of the cysts start to form in the ovary, and that's when it becomes pretty painful at that point. Some of the risk factors some of the risk factors for PCOS are mostly genetic and environmental. The etiology or the exact etiology of PCOS is unknown at this time, but it's mostly thought to be related to genetics and possibly intrauterine exposure to high levels of testosterone. So if you are pregnant and are using anabolic steroids or something like that, you may have a child who may develop PCOS later on. A lot of the lifestyle factors and environmental exposures have been associated with a more severe PCOS phenotype. So the sedentary lifestyle associated with increased metabolic dysfunction and weight gain is associated with oligoanovulation and hyperandrogenism. So BPA and other environmental androgen disrupting chemicals may accumulate to a greater extent in individuals with PCOS because of decreased hepatic clearance. These also induce androgen production and insulin resistance, which is one of the big factors of PCOS. And the biggest risk factor is obesity. It's not believed to cause PCOS, but it is known to exacerbate the symptoms quite a bit. Obesity is present in 30 to 75% of women with PCOS, and adipose dysfunction contributes to the development of glucose intolerance. So if a person were to come into, say, an ER or Ready Med or something like that and have, I guess the symptoms you would look for PCOS would be, severe abdominal cramping. They would also have the characteristics of possibly obese or metabolic syndrome. They could have a high blood sugar. So those are the main. That's how the people with PCOS present. Generally, the way to diagnose it is with an ultrasound and also a metabolic panel or an endocrine panel for some blood work, just to check and see if any of the hormone levels are really out of whack or not necessarily normal. After someone's diagnosed with PCOS, the pharmacological treatments are generally more based on treating the symptoms. So it depends on each symptom, but a lot of the time they're put on metformin or some of the other drugs to help increase your insulin sensitivity. And it also helps to lower the androgen levels, since there's a cause and effect relationship with just about every single one of the hormones in your body. As far as non-pharmacological treatments go, it's usually weight reduction for the obese, and they also have what's referred to as laparoscopic ovarian drilling, which is believed to destroy androgen-producing tissues.